This time we will discuss how to use prep guide or prep cupping, and also we will touch the topic how to form soft tissues around fixed bridge. So let's go. Hello dear friends, dear colleagues, this time I will present you a very interesting case, and I will show you how and when actually we can use so-called prep guide or prep cupping or prep checker. And also I will give you some tips and tricks related to soft tissues management around fixed bridge. Before I will continue, I would like to remind you to sign up to our YouTube channel and also not to forget to put likes. So let's go. Here is the initial situation, old PFM bridge that patient was not very happy with, and we decided to replace it. I insisted to put an implant, but patient refused, and actually the plan was just to do another more aesthetic and more functional bridge. We decided to go for Zirconia. So let me go very quickly through the treatment process of the abutment teeth. You can see here premolar that was restored with composite and metal post. So this post was removed very easy with ultrasound, and then we just rebuilt it with dual cure composite material. The same was done for second molar. Here you can see some steps of treatment. We removed the core, then we made root canal retreatment. We get additional isolation with a flowable composite. We made the root canal retreatment and rebuild the process, the core, with core build-up composite material. So this is how we ended up with preparation. Also, I started to do soft tissue management. I used burr. I just carved the soft tissues with the burr, created some concavity, and my temporary bridge that I used from the index. We got the index before cutting the old bridge. We got the index, and then I filled this index with a pro-temp. So this was my temporary bridge. And this temporary bridge was relined in pontic zone, was relined by normal composite to create a contact pontic zone to make effect that we have tooth going through the gum. So before doing this, you have to evaluate how much soft tissues you have actually. And you can easily measure the soft tissue. So one of the easiest and less painful method is to use your needle that we use for injection, for anesthesia. So you put a silicone stopper on the needle and you go all the way through the bone. So you touch the bone and you can see the stopper and you can actually evaluate the distance. Okay, so we went to that approach, creating so-called contact pontic zone. After 2 weeks, you will be able now to see the result after 2 weeks. This is temporary bridge. I'm removing the temporary bridge with a forceps. We use carboxylate cement to cement our temporary restorations, and you can see now the response from soft tissues. You can see papillas, you can see no inflammation, so basically everything works pretty well here. And we are ready for final scan or final impression. Here is the picture from the DSLR camera, so you can see also no inflammation, pretty good healing process after 2 weeks. And we scan, okay? We use intraoral scanner to scan the zone. It's pretty deep scan, as you can see from the distal area of the molar tooth. And here is the model with final restoration, and I would like to show you something very interesting. If we compare a model that is from the left and my preparation that was scanned on the right, you may see the difference on the occlusal surface. The reason is that dental technician made adjustment on the design because the reason was actually not because my preparation was not efficient and I didn't give enough space for dental technician. Actually, my preparation was correct and my temporary bridge was thick enough. But when we already designed the project, patient decided to change her antagonists, the lower teeth. She wasn't happy with crowns on antagonists because they were flat and the chewing efficiency was very low. And we redesigned the occlusal surface of upper bridge and also on lower teeth. So we made lower teeth slightly bigger, higher. We made some cusps, and thus we didn't have enough space for the upper bridge. And we decided not to redo the design, to rescan or whatever, to re-prep. So we decided to go for the prep checker, the prep guide or prep copying. So it's very easy device that your dental technician can give you. So you put this device on the tooth. You can see exactly how much you need to cut. You just take the burr and you prep till you reach the peripheral aspect of the prep guide. It is not that precise as you prep and you scan and your dental technician get the scan or impression, let's say, but it is also pretty good alternative in case, for example, if you're a patient from another city or from another country or whatever. And in this case, we just need to cut the core material. No problems with the tooth structures, just core material. Okay, again, before prep cupping, after preparation, that's it. And if, let's say, you cut a little bit more than necessary, you'll fill the gap with cement, and the thickness of your restoration will compensate elastic deformation underneath. At the end of the day, we use composite cement, and the composite cement is pretty much similar to the core composite material that we used for core build-up. Okay? If you will not cut enough, you will be not able to fit your bridge. They will be shaking. When you put the bridge, it will shake. So in this case, when you cut with the prep guide, it will show if everything is all right or not. So this is after my re-prep, let's say. And you can see here how do we check the fit of the bridge. After that process, after re-prep, let's say, we have our final zirconia bridge. We put, we press, there is no shaking, it's pretty stable, and we can say that the prep guide worked perfect. I decided to cement the bridge without rubber dam here, but I decided also to do adhesive cementation. We used so-called universal composite cement. Okay, we prepare restoration according to APC protocol, abrasion, primer, and composite for zirconia. There is a concept by Marcus Blatt. You can Google it and you see. But actually, if you want to learn more about cementation of zirconia crowns or bonding of ceramic onlays, I would like to invite you to our online masterclass that is available already on our webpage. The link is below this video. You can go and get a lot of protocols and tips and tricks related to cementation and bonding process. This video is about benefits that you will have from our online workshop. Presence effect. This is a unique feature by Belograd Academy that literally moves you to our training center and you can stay close to speaker. This is like over-shoulder format. The training process is filmed through the video system from the microscope, and there are two more cameras broadcasting close-up and general view. This way you can see everything in precise details. Efficiency. Do you agree, guys, that over-shoulder workshop with detailed video and explanation is way better than regular slides? The third benefit is convenience. So basically you don't need to go anywhere and you can study in comfort conditions, in your home, in your office, during running exercises, from your phone, from your computer, from your tablet, and you can do anything you want with the content. So join us as we shifted online education into the next level. So how do we clean teeth? I'm using chlorhexidine with a special brush. We clean the teeth with a chlorhexidine after temporary cement. Then I'm using ultrasonic diamond tip with a very low power, almost nothing. So we disinfect, and also we make some abrasion. It's like a micro abrasion with diamond coated ultrasonic tip to make surface slightly rough. Similar to air abrasion with aluminum oxide, not the same one, but similar, let's say. We clean, we micro abrade, then we clean again with chlorhexidine, then we rinse, then we dry, and then we go with our universal self-adhesive cements. So that is the process of cementation of such bridges. I would like also to say that if you want to improve your prep skills from the very beginning, without prep guides by the way, I will be your prep guide. So I would like to invite you to our Belograd Academy that is in Kiev for hands-on course, for big preparation course, and you will master during 2 days, you will master your preps for veneers, for crowns, and for overlays. So very intensive program, pure hands-on, and you will be amazed by content and efficiency of the training process. So that's it, guys. Was happy to present you another case. I would like to wish you to be healthy, and may the dental force be with you. Bye bye.